Appreciate Jon very much coming on today from the Nipissing Ontario Health team. And yours is, I'll describe it as transitional hospital to home type program, but you might actually provide like just one sentence or two about that program. And I know you're picking up really high risk people. And my question to you, Jon, I think is around these, as you reflect on these findings, what do you think, the opportunity for your program in Nipissing and maybe in general for the leading projects to have? What kind of impact do you think these leading projects are going to be able to have?
Thanks, Walter. Yeah, so first of all, my name is Jon Kwok. I fill the role of Project and Quality Lead at Nipissing OHT. Our model does involve hospital. I wouldn't quite call it hospital to home, but it is similar. We do have a separate H2H model as well. But yes, we try and pull patients both from hospital and community, those who are crisis and high risk, and try and support them on the pathway to long-term care. So actually, we've recently, we'll say, renamed or dubbed the program just because Leading Project didn't really have the same kind of oomph with the patients. So we're calling it Home to Long-Term Care. So yeah, that's how we would describe our model. In terms of impact, I do have a few thoughts. I'll try and kind of keep them connected here. But so first of all, from kind of a broad provincial lens, the first year and a half to 2 years of this project were spent really supporting discussions, engagements, and overall planning of the common elements across the group of 7 leading projects. So there's that opportunity for a kind of province-wide collaboration. I see this as a great opportunity for the OHTs to have a say towards the future of home care. From there, the more recent months have been focused on kind of transitioning to implementation. So you've heard today a couple of times how projects have gone live, and we're all at different stages of that. But as we move towards that, the conversation's really moved more to a local focus. So I don't really want to speak on behalf of the other leading projects, but I will speak to kind of Nipissing. So we saw an opportunity, a strong opportunity to shape a model that really meets our local needs. So a truly integrated model where maybe we'll call it the traditional primary players like OH at Home, acute care, even the service provider organizations, they're still leading the way, but very much being informed by and consulting other partners in the region, primary care, community support services, and yes, patient-family caregivers. So all working together. So I'll give you a specific example. So kind of not prior to the project, but kind of throughout, we heard that there were situations where care providers from different organizations didn't always have awareness of how each other was supporting a specific patient. So for instance, PSW from one team might arrive at the same time as an OT from another team, and there just wasn't that communication. So our hope is through coordinated care planning, care conferences, even digital collaborative tools to improve that communication and collaboration to improve quality of care for the patient. So that's kind of broad, and then moving more closely. But having said all of that, tying in today's topic a little bit more, hoping that the evaluation and the data points combined with the subjective and experiential lessons learned, hoping that they provide more information that can be used in the development of an overall home care roadmap.